Those very first signs of pregnancy can be so subtle. For some women, they pop up within just a week of conception. But for others, it takes a lot longer. One of the biggest questions we hear, though, is this: can you actually feel a change in your stomach right from the get-go? That's exactly what we're going to dive into. All right, so let's get right to it. The big question. Can you really know you're pregnant just from some weird feeling in your stomach? It's a pretty cool idea, right? So let's break down the science and find out what your body is actually trying to tell you in those first crucial days and weeks. But to really answer that, we can't just talk about feelings. We've got to go deeper, to the exact biological moment where this whole journey really kicks off. This, right here, is the true starting point. Implantation. It's when a fertilized embryo snuggles in and attaches itself to the wall of the uterus. The second that happens, it's like a chemical signal blasts out across your entire body, basically shouting, "Okay, everyone, new project underway." And from that exact moment, everything starts to change. So once implantation happens, your body's internal communication system just kicks into overdrive. This is what I like to call the hormone takeover, where these little secret messengers start completely rewriting your body's daily playbook. The most important change is this super fast rise in three key hormones: estrogen, progesterone, and beta-HCG. And that last one, well, that's the big one. Human chorionic gonadotropin is the specific hormone that home pregnancy tests are designed to find. Just think of these three as the project managers for early pregnancy. They're pretty much responsible for every single sign we're about to talk about. Okay, so what does all this hormonal chaos actually feel like? Let's circle right back to our main question: what are the first clues you might actually notice in your stomach? The thing you have to know is that these feelings are super subtle. We're not talking about some big, obvious change here. It's more like a faint little flutter, kind of like butterflies, or maybe a gentle pulling or stretching feeling deep down in your lower abdomen. It's so easy to miss this or just brush it off as something else, but this is often your body's very first whisper. Now, this is where it gets confusing for almost everyone. Is it pregnancy or is it just your period coming? This is where paying attention to the location and the type of feeling really matters. Implantation cramping, that's usually felt way down low, below your belly button, and it often feels more like a dull, constant ache. Period pain, on the other hand, can be much sharper, more intense, and it often throbs. Recognizing that subtle difference can be a huge early clue. So, beyond cramping, there's another major player making things feel weird, and its name is progesterone. One of its main jobs is to relax smooth muscle tissue all over your body to keep the uterus from contracting. But guess what? That relaxing effect isn't just for the uterus. It hits your entire digestive tract, and the result? Everything slows way down. And because of that big digestive slowdown, you get this whole collection of not-so-fun symptoms. This is why your stomach might feel firm or full or just really uncomfortably bloated from gas. You could also get indigestion, heartburn, maybe even a random case of the hiccups. And yep, it's all a direct result of progesterone doing its important work. But of course, it's not all about your stomach. Your entire body is getting that hormonal memo, and it starts sending out signals from all over the place. One of the most classic signs is feeling like you have to pee all the time. And there are actually two reasons for this. First, your uterus starts to expand, and that puts direct physical pressure on your bladder. At the same time, that same hormone we just talked about, progesterone, is relaxing the muscles of your urinary tract, which just makes the urge to go even stronger. Okay, now pay close attention to the timing on this one. For so many women, breast changes are one of the very first things they notice. Sometimes this happens a full week before they'd even expect their period to start. It's an incredibly early and really common signal. So what are you looking for exactly? Well, a feeling of fullness or heaviness, maybe some general tenderness when you touch them, and then visible changes like the areola, the area around the nipple, getting darker, or the nipples themselves becoming more pronounced. This is just your body getting the milk ducts ready for a job that's still months and months away. Those hormonal shifts can also throw your senses for a complete loop. A lot of women report this weird metallic taste in their mouth. Suddenly, the coffee you love every morning might smell totally overwhelming. Or you might find yourself craving super sour, tangy foods that you would never even think about eating. And finally, don't underestimate just feeling different. Your body is working incredibly hard, building a whole life support system from scratch, and that can lead to a level of fatigue that is just overwhelming. Aches, headaches, crazy mood swings, and even a slightly higher body temperature are all signs that massive changes are happening on the inside. So, we've covered a ton of clues, from little stomach flutters to suddenly hating your favorite food. But let's be real, clues and feelings are not the same thing as certainty. So now we need to talk about how to get from suspicion to actual confirmation. With all these symptoms that could easily be mistaken for PMS or stress or just having an off week, it's so easy to get confused. So, in the middle of all that noise, what is the single most reliable signal your body sends? What's the one thing you absolutely should not ignore? This is it, right here. While all those other signs are really valuable clues, the most dependable indicator that you should probably investigate further is a missed period. That's the one sign that takes you from a simple suspicion to a real, distinct possibility. So, here's the path to getting a real answer. First, pay attention to those subtle feelings we've been talking about. Next, and this is the hard part, wait for your period. If it's late, grab a home test and take it a few days after. And if you absolutely need to know for sure as early as you possibly can, a doctor's blood test is the most definitive answer you can get. So, in the end, while you can totally learn to read the subtle language of your own body, just remember that those feelings in your stomach are only the very beginning of the story. To get the full picture, a test is the only thing that can give you a clear, certain answer. It's a really personal journey of listening to your body, but it's one that ultimately needs that confirmation to know the true story.